Hi, everyone. Welcome to Ask the Horse Live. I'm your host, Michelle Anderson, Digital Managing Editor of The Horse. Tonight, our topic is equine metabolic issues. What are the differences? And it is brought to you by Metabolic, made by Equithrive. If you're listening tonight, I'm guessing you have a horse who might have gained some weight easily, or maybe his neck is getting a bit crusty, or possibly his coat has seemed a little bit more shaggy than in years past. If you have one of these metabolic type horses who's showing signs of Cushing's, equine metabolic syndrome, or insulin resistance, you're definitely not alone. And if you're confused about the difference between these conditions, then you're definitely not alone. To help us all better understand equine metabolic issues, we're joined tonight by Dr. Amanda Adams, a researcher at the University of Kentucky, and Dr. Vernon Dryden of Burr Oak Equine Veterinary and Podiatry Services. So we're going to jump right in because we have a ton of questions. We're going to start with Dr. Adams. Can you tell us a little bit about your experience and interest in these metabolic horses?
Yeah, sure. It's also great to be joining you here for this podcast. A very important topic indeed. And so I have a personal interest as I've owned a number of horses that have had both PPID and EMS metabolic issues. But professionally, my interest started in 2011 whenever I started my research program, which was really focused on geriatric horses and really looking at the effects of old age on immune responses in geriatric horses. And of course, given the fact that about 30% of geriatric horses are affected by PPID, my interest then expanded into the study of endocrine diseases of both PPID and equine metabolic syndrome. So at the University of Kentucky, we currently have a herd of both PPID and EMS horses that we're trying to better understand and answer some questions that you all may have tonight.
Okay. And Dr. Dryden, can you tell us about your interest in metabolic issues and the role that those play in your practice?
Absolutely, and thank you for having me tonight. Hope to get into some good conversation. So this is a really important topic for many of the clients and patients that I treat, because many of them are laminitic due to their metabolic disorder, dysfunction, and PPID. So a majority of the cases, laminitic cases that I work on, in my practice being solely lameness and podiatry based, are due to this ailment. So it's a very large demographic of horses that I deal with that have this issue. So it's very close to my heart for sure.
A quick review of our Ask the Horse live format for everyone who's listening. We're going to be starting with the questions that you submitted during registration. As we move through those, if you have questions you'd like to ask live, or if you have a follow-up question or a clarification from one of the doctors, you can enter those in the chat window in front of you if you have joined us via your web browser. We're going to do our best to get to as many of your questions as possible, so we're going to go ahead and get started. I'm going to start with Dr. Dryden. Can you explain to us a little bit about what we mean by a, quote, metabolic horse? What specific conditions are we talking about, and how are they related or not related?
Absolutely. So let's first talk about what we see phenotypically in a metabolic horse. These are our easy keepers. These are the horses that seem to get fat on air. They always have a nice heavy fat layer on them, with distinct fat deposition over the tail head, just behind the withers, and the cresty neck. Very, very typical for what we see in a metabolic horse. The key being that these horses have an insulin dysregulation or insulin resistance, and that coupled with pasture and carbohydrate intake and inability to monitor and regulate their insulin leads to a cascade of events that causes laminitis, which is another very common scenario that we see with these cases. So that's pretty much it in a nutshell, aside from the PPID or the Cushing horses, which can also have metabolic EMS and insulin resistance. So you can have the full Monty, if you will, with some horses that have both EMS and PPID or Cushing's.
Dr. Adams, we have a question from Gail in California, and Gail says that she's heard that metabolic testing should be done in the fall, but recently read that maybe it could be done at any time, which is true.
Okay, good question. So when we're talking about diagnosing insulin dysregulation, we're looking at more specifically the equine metabolic syndrome horse. And so when we diagnose insulin dysregulation, we're either measuring basal resting insulin concentrations or insulin responses to the oral sugar test, more likely than not. And so we really don't see, or we don't have the research behind this to say that season affects insulin responses. So when we're looking at diagnosing for insulin dysregulation, we can test throughout the year, and we have reference ranges established for both basal insulin and obviously insulin responses to the OST. Now, when we're talking about diagnosis for PPID, in diagnosing PPID, and aside from clinical signs of disease, we're looking at resting ACTH levels or ACTH levels in response to the TRH stimulation test. And those are levels of ACTH and their response to TRH are greatly affected by fall. So we currently have reference ranges for resting ACTH for fall and non-fall months, but we do not have reference ranges for the ACTH response to the TRH stim test, not quite yet. We've actually done some research trying to establish some of those fall and non-fall cutoff values for the TRH stim test, but those results are not yet published. So that's when you can test for resting ACTH levels in fall and non-fall months, but you should not be testing with the TRH stim test in the fall months. We do not have reference ranges for that, but outside of the fall months, yes, you can test using the TRH stim test.
Okay. So, Dr. Adams, am I understanding correctly then that the test for the EMS or IR horse is different from the Cushing's horse?
Yes. Well,
okay.
You're correct. So when we're talking about the equine metabolic syndrome horse, we're more worried about insulin, more than likely worried about insulin dysregulation in those horses. Well, insulin dysregulation is a characteristic of EMS, right? And so then we're worried about insulin and testing for insulin. But for the equine Cushing's disease or pituitary pars intermedia dysfunction or PPID, right, we're more interested in ACTH responses. But with that being said, our PPID horses can also be insulin dysregulated. So you might want to be testing for both.
Okay. Yeah, and so that was going to be my next question for Dr. Dryden is how do you as a vet decide which test the horse needs? How do you know if this horse might be a Cushingoid horse or this horse might be an EMS or IR horse?
That's a great question. You don't know unless you test. So typically, if I have a horse that I get presented, almost always it's because they've gone through a laminitic episode. I'm going to test for both because you don't want to take that chance of missing something. So I would recommend if you're going to go through the motions of pulling the blood, you might as well go ahead and test for both. It's highly unlikely to have a PPID case in a young horse, a horse less than 10, but it can happen. But you know, that would be my recommendation, is just to test for it if you're concerned.
Okay. Dr. Adams, we have a question from Bernadette in Aiken, South Carolina, and she wants to know what are some of the first signs that your horse might be having metabolic issues. So Dr. Dryden had mentioned laminitis. Are there any signs earlier than an acute episode of laminitis?
Right. So metabolic issues is quite broad. So when we're looking at the equine metabolic syndrome horse, early signs or first signs are, they're starting to put on more weight. So you're looking at general obesity. So trying to keep track of your horse's body condition score would be very useful and helpful, and making sure that that doesn't creep up over time. Also looking at the cresting neck scoring system. So paying attention to the neck crest, and if that starts to increase over time. Those are some subtle signs or signs that should flag that this horse may be becoming equine metabolic syndrome. In terms of the PPID horse, We can see subtle changes in attitude, lethargy. You can start to see some regional hypertrichosis. We're not talking general hypertrichosis, so the really shaggy, hairy, long-haired coat, but regional hypertrichosis, so the long, more wispy type hairs that are along the chin, some on the legs, some under the belly. And then you'll see some delayed shedding in these horses early on, and you will start to see some lost muscle mass on the top line. You might see that the horse is having more issues with recurrent abscess problems. And so those are really some signs that you should really start to do some diagnostic testing.
Dr. Dryden, our next question is from Christine in Ohio for you. She wants to know if metabolic horses are always overweight, or can they also be thin, or instead be thin?
Perfect. Another good question, because this is where the lines get a little blurred. Typically, we think of a metabolic horse as an overweight horse with, easy keeper, fat deposition everywhere, but these horses can also be thin if they also have a concomitant PPID issue. So the older horses that are also Cushing's but may have insulin resistance and metabolic syndrome are often very thin but still have a bit of a crusty neck and some odd adipose deposition over the withers and tail head, but are thinner horses. So yes, they can be both.
We have a question from our live audience, Dr. Adams. I'll give this one to you. It's from Connie, and she says that her vet says that in the early stages of PPID, the test can come back negative. Do you agree? And how might you treat, and how often would you test a horse to check to see if they get a positive response?
Okay, good question. So if your horse is a suspect or early case PPID, your vet should be using the TRH stim test for diagnosing this horse, because that's what we're trying to advocate for, early diagnosis of PPID. So that's first things first. Second is make sure, I always try to preach that, the blood work is getting sent off to labs that have been validated for assaying these hormones, and those would be Cornell University and Michigan State University for measuring ACTH and insulin. Those are the labs that I recommend. They have the validated assays and reference ranges for what is normal and what's not normal. So, if you're sending your blood off elsewhere, you might be getting false negatives. So two really important points there. And I would check it, I think monitoring these animals as frequently as you want is great, but, at least do a fall and a spring endocrine test, I think is a really good recommendation.
Okay. And Dr. Adams, it seems like recently there has been this push to identify PPID earlier on than we used to. Like, it used to be like, oh, well, my horse has been shaggy for a while and kind of has some goopy eyes, and maybe we had some abscesses, and okay, we should probably go ahead and test. But now it's getting pushed earlier and earlier. What are the benefits of getting an earlier diagnosis?
Yeah, good question. So an earlier diagnosis, then you can start treatment earlier, and Pergolide is the gold standard treatment for PPID. Pergolide will basically slow the regression or the progression of down. It's not going to turn it off completely, but it's going to slow the progression of the disease, thereby slowing down some of the clinical associated problems that these horses have. So that's really the key, is to really kind of be very proactive in that area, because basically we're talking about it's a tumor of the pituitary intermedia, and so once the tumor is established, obviously this is Pergolide is not like a chemotherapy type drug. It's not going to destroy or reduce the tumor itself, but it's going to slow the progression down from that tumor getting any larger and causing more problems.
We have a question from our live audience, Dr. Dryden. I'm going to give this to you. It's from Esther. And Esther says that here in Canada, when the frost hits, the sugars are released into the grass almost overnight. How can we help our metabolic horse that's grazing on these pastures?
Well, if you know your horse is metabolic, simply don't allow them to graze or use a muzzle, limit the grazing after a hard freeze for sure. And because your sugar content does go high, sky high, right after a hard freeze, any drastic change in weather, whether it be hot or cold, and then try to limit, the exposure to grass if at all possible. So there's no real easy way around it, because these horses are so sensitive to carbohydrate issues that you can't allow them to ingest it if it is going to spike.
So, Dr. Dryden, you're in Lexington, correct?
Correct.
Okay. So, and I am in Oregon in the desert. And so, your guys' horses, my coworkers, the office is there in Lexington, and all their horses are on pasture all the time. And my horses are on dirt all the time. Is it possible to notice EMS sneaking up on horses like mine that aren't out on pasture with access to grazing all the time?
I think I would be very, very, very observant of your horse's phenotype and whether they are an easy keeper and how they respond to feed and I mean, I think that's going to be and as Dr. Adams talked earlier about the hair coat, if they shed out well, how well their hair coat does shed out in certain areas. That's all going to give you good insight as to whether or not this horse may have an issue, and to be careful about the pastures. So until your horse is, introduced to something like that, it's hard to know. But I think I would be very observant and cautious going forward with it.
Dr. Adams, we have a follow-up on your comment about pergolide. Liz is in our live audience, and she wants to know, what is the difference between Percend and pergolide?
So Percend is basically the brand name. Pergolide is the actual compound drug name. So it's the same thing.
Okay. Dr. Adams, we have a question from Raven in Wisconsin, and Raven says, what would be best to feed an Icelandic horse who is tested negative for metabolic issues, but still gets fat just looking at grass hay?
Right. Yeah, good question. And I think I always like to stand on my soapbox again, make sure, your vet is doing the proper testing and make sure they're sending the samples off to the proper lab so that you're not getting false negatives. But if your horse is obviously an air fern, you still want to manage for obesity, right? So you really want to manage for that horse coming back to an ideal weight, right? Because we know obesity is a predisposing factor to horses developing insulin dysregulation. So you want to manage with diet and manage with exercise. But I would also like to preach too, when you're thinking about managing with diet, it's a really good idea to really try to get a proper weight on your horse. And if all you have access to is a weight tape, that's great. But really figure out how much your horse weighs and how much hay you're actually feeding it based off of weight. So if you could get a weight on your flakes of hay, a weight on your horse, then you can calculate, the percentage of hay that you should be feeding that horse. So we feed at 2% of body weight hay to maintain body weight at current body weight. And then if we want to induce weight loss, we drop down to feeding them 1.5% body weight of hay. So I always try to tell people that's really, really important to try to really get a handle on the exact weight and what you're exactly feeding these horses.
Mm-hmm. And how does exercise play a role with those horses? Like, can you ever ride them enough to keep them from being overweight?
Yeah, so exercise is great, I think, as much as the horse can tolerate. Some horses, though, especially if they are of a breed that is more predisposed to equine metabolic syndrome, they can be somewhat resistant to even losing weight with exercise. So I think it's just not a one-size-fits-all situation. But exercise will, help speed up metabolism, help drop some of those insulin values down, help the horse lose weight. But exercise only works hand in hand if you're feeding the proper diet, right? So if you're feeding calorie excess and you're exercising a lot, then they're just gonna, they're gonna basically defeat one another. So increased exercise along with slowly decreasing calorie intake should drop weight in these horses.
Dr. Dryden, we have a question from our live audience. Fiona has an insulin-resistant mare who's 14. 3 weeks ago, she had a laminitic episode that they caught early. She's now better, but seems very stiff in the mornings. Can Cushing's be present in the early stages with stiffness and gait, or can it present early on with stiffness and gait? She said that she's looking at getting a PPID test done as well.
Yeah, I would definitely encourage getting ACTH, endogenous ACTH done and see what that shows you. And if the results are non-conclusive, I would definitely go to a TRH stem test with that. The fact that she has had a laminitic episode and is already metabolic, there's a likelihood that you have an additional, process like PPID occurring. So with that, I would like to also comment on one other thing. We were talking about Presend or Pergolide and, treating with that. There are cases as a clinician that I get ambiguous results with ACTH testing, and I have to make a decision to treat or not to treat. In some cases, even though I don't have a positive test result, I absolutely encourage testing for these and treating with positive test results. However, some of them are ambiguous, and I do end up treating because I have a laminitic horse that needs to be stabilized, and I will go ahead and treat with Presend. And most of the time, I'm right. The horse responds, and we move forward. So just know that is an option, and as a clinician, you sometimes have to make that decision.
Okay.
We're actually, go ahead. Sorry. I was going to pop in and say we're actually investigating the effects of Pergolide or Presend on not only, ACTH responses in the horse, because we know what that does, but kind of what impact that has also on insulin responses. So it'll be interesting to see those results.
And is there a timeline for when that'll be published, or are you guys in the thick of it? Probably in another, I'd say 8 months or so. We're kind of right in the middle of the study. Exciting though. Yeah.
That's great.
Boehringer, I would like to put in a fact that Boehringer is sponsoring this, so they're excited about it as well.
We have a question from Allison, Dr. Adams, and she would like to know what is the difference between EMS and IR. And I think we got to that a little bit in the first question, but is there a succinct way that's just really clear for people who are listening so they can understand the difference between those two types of horses as we go through the questions?
Yeah, and now we'd like to confuse everyone again because we've got in the term inoculation. So equine metabolic syndrome is sort of an umbrella term that describes the horse that has 3 characteristics: increased obesity or general adiposity, they're insulin dysregulated, and then they're predisposed to laminitis. So that's the definition of an equine metabolic syndrome horse. If we want to define insulin dysregulation, that's a term now that encompasses both insulin resistance and hyperinsulinemia. And hyperinsulinemia is essentially an increased basal level of insulin in these horses that are equine metabolic syndrome. It also encompasses the fact that these horses have high insulin values postprandially after you give them a meal or a response to an oral sugar test. So that's sort of hyperinsulinemia. Insulin resistance is actually when the tissues become insulin resistant, basically are not responding to the body's insulin. And so that's why then the pancreas has to try to overcompensate for the tissue insulin resistance and produce more insulin to help those tissues really bring in the glucose into the body. And so in essence, those insulin resistant animals are more than likely hyperinsulinemia, but they can be one or the other or both. And so insulin dysregulation is a term that encompasses both fasting hyperinsulinemia, postprandial hyperinsulinemia, or tissue insulin resistance.
We have a question from our live audience, Dr. Dryden. It's from Maggie, and Maggie wants to know if there are non-pharmaceutical treatments for EMS.
I think the most logical treatment would be diet and exercise. Aside from that, metabolol seems to be one of the most effective treatments that I've used as far as regulating insulin. So, I think by far your balanced ration diet and exercise are going to be good. Supplements on the market that are supposed to help with metabolic regulation have magnesium and chromium in them. So those are your options as far as non-prescription pharmaceuticals.
I'll just pop in really quick if you don't mind. In terms of natural supplements, be careful with that because not a lot of research has been done behind some of those supplements that are out on the market. So in terms of chromium, there have been just one study, I believe, that actually in that study, or might have been two studies that actually did not show an effect on insulin with chromium supplementation in horses, and one magnesium study that did show actually did not show effects as well on insulin. And then cinnamon is another one that people like to talk about, but no research has been conducted on that. Short chain fructose oligosaccharides, a study was done on that, and it actually did show some modest improvement in insulin sensitivity. And then, of course, metabolol, I'm very familiar with. That is actually the active component in that is resveratrol, which is an anti-inflammatory antioxidant that is actually found in red wine. And so we actually did the research behind that study and showed that postprandially, horses improved their insulin responses with that, which is an important thing to have.
Our next question is for Dr. Dryden. It's from Laura in Oregon. Laura says she has a hunter that requires joint injections at the beginning of the show season. Is there any added risk if he's showing signs of weight gain and possibly a metabolic disorder going into the spring and the show season?
So this is a great topic and one that I wanted to make sure that we covered this evening because in my practice, I see an over-representation of horses that are metabolic and or Cushing's PPID that become laminetic shortly following treatment with corticosteroids for intra joint injections, essentially. So this is a really big concern for me. We're talking with Dr. Adams earlier, and there is a scenario where soon after joint injections are performed on horses, we get a spike in insulin. So in a horse that's already insulin resistant and has a high circulating insulin level, this can push them over the edge because what we've seen in studies has shown us that high insulin levels can cause an inflammatory response, a cascade that initiates a laminetic episode. So it is a very, very big concern for me. And if your horse is metabolic or even showing signs of it, I would be very, very cautious of especially multiple joint injections. And I would prefer to use something like IRAP or Prostride or some form of biologic as opposed to a corticosteroid if I did have to treat a joint for a condition.
Yeah, and this is definitely a topic that's very near and dear to my heart. And we are hopefully in the next year going to be doing a study to compare some of the different glucocorticoids joint injections in normal healthy horses and how they compare in terms of insulin responses post those injections. As Dr. Dryden said, there's only been one published study that has shown post-injection using one glucocorticoid type that insulin spiked greater than 10 times. So you definitely don't want that to happen in a horse that's already metabolic, or you are going to be dealing with laminitis, and it's devastating, as we all know.
Okay. We have a question from our live audience. Connie wants to know how reliable are blood insulin level tests and what affects the analytical results of those tests fasting, sample handling, stress. Dr. Adams, do you want to touch on that?
Yeah, sure. So insulin is affected by essentially by the number of factors that you just named off, but not nearly as affected as ACTH is by stress. And so insulin's pretty stable in terms of handling the samples versus ACTH is a bit more sensitive to handling. So insulin is pretty reliable. And the recommendations are now, if you're looking at basal insulin responses in horses, there's actually no need to fast the animal. So you can just go out and grab them from the pasture or out of your dry lot if they've been receiving hay, and go ahead and pull the blood sample. And that's no longer recommended to fast those animals to look at basal insulin. But if you are performing the oral sugar test, we're still recommending a 3 to 8 hour fast with that. So that the insulin is pretty reliable. I measured thousands of samples, insulin samples, and we've tested the same horse on different days and different months and throughout the year, and all of it really seems to make sense, the results that we get back. So I wouldn't be too concerned about that when you're talking about insulin. Now, ACTH, again, is a bit more responsive to stress situations, feeding. We know that actually feeding can actually affect ACTH levels, and then handling the samples is also another one that your vet needs to take into consideration when shipping those samples off.
Dr. Dryden, we have a question from Denise in our live audience. She asks, will severe drought conditions cause grass to concentrate its sugar? So even when the grass plant is very short and the pasture looks dead, can the grass still be dangerous for a metabolic horse?
Absolutely. Anytime the pasture, the grasses are stressed, an overgrazed scenario or a drought scenario, they can definitely be a high sugar content at those times, for sure.
We have a question from Valerie, Dr. Dryden, that's related. And she's in our live audience, what are acceptable levels for sugar and starch in hay, and can she get away from having to soak it? You know, that's that extra chore to have to soak that hay to reduce the carbohydrates in it.
Yeah, that's a great question. And actually, I would probably defer this to Dr. Adams, because I'm sure she has more values for this, more current values than I would. If that's okay, yeah. Dr. Adams.
Yeah, no, sure. So non-structural carbohydrates, these are the soluble carbohydrates, mainly the sugars and starches, right, in the grass and the hay. And so what we're looking at are essentially values lower than 10 to 12%, definitely lower than 12% NSC. Values. If you could find a hay with 10% NSC values, that would be fantastic. And I hate to say this, but really these recommendations, the 10 to 12% NSC or below recommendations, are really coming off of work that was conducted in PSSM horses. So we actually don't know what values we should be feeding that are really safe for the insulin dysregulated horse. But we are actually working on that right now. I hate to say it, though, it's going to take us probably another year to get those numbers out or longer, but we actually don't really have the data or the research behind that. So we all just sort of refer back to that PSSM study and say that it's, you know, we should be feeding below 10 to 12% or at that level of NSC in hay. And so I think, was that the only component of the question?
And soaking.
Oh, sorry, soaking. So yeah, if you don't have access to low NSC hay, then, you know, soaking may be your only option. And so soaking for a minimum of 30 minutes, but an hour would be better. And then, of course, you need to drain the water off because that's going to have the sugars in it before you feed as best as you can. So if that's kind of your only option, that may be, I'm sorry, the best option. We don't at the moment we just don't have a lot of other options. So I was trying to find the crappiest hay essentially that you can, which can be difficult, especially around here in central Kentucky.
Yeah, you guys
I think we're neon green
special
right now. Yeah, we're special.
And
sure.
I might add that the easiest way that I've been able to get my clients to soak hay, because getting them to do this is a little bit tough sometimes. It's to put the hay in a hay net and then put it in a big tub or a muck bucket or something that you're going to designate for your soaking. Fill it up, let it sit when you come out to do night check or whatever, and then pull it out in the morning, let it wring out and hang it for them. It seems to be the easiest way, and that way you don't have an easy scenario to get the hay out of the water too.
Mm-hmm. Yeah, it's definitely tough this time of year when it's getting down to 20 at night and trying to get hay soaked for those horses. It adds to the challenges of managing them for sure. We have a question from Penny. Dr. Dryden, I'll give this one to you. She wants to know if a horse is on pergolide, should be routinely tested for Cushing's to check for dosages and levels.
Yeah, I typically check my PPID horses at least once a year, if not twice a year, checking their ACTH levels, making sure that they're able to maintain on the dose that we have if we need to adjust it up or down. Typically, they're going to start with 1 milligram tablet once a day, and then if you're not able to control it, you go up from there by 0.5 milligram. For me, it's usually 0.5 milligram, and then just keep a monitor on it. But I say at least once a year, but ideally twice a year.
Dr. Adams, Mark is in our live audience, and he would like to know what grass forages have the lowest sugar values.
Right, good question. So don't assume that just because the hay might look not the best quality, that it's going to have the lowest NSCs. So always, if you can, and if you have a large lot of hay that you're going to be using or purchasing, I would definitely try to send a sample off just to be sure. But, we're talking about cool season grasses versus your warm season grasses. So your warm season grasses are more than likely going to have lower NSC values, but those are hard to get a hold of. So, your Bermudas and Tests, cool season grasses, your Timothys, orchards, bromes, and all of that, they're going to have varying levels depending if they're early cut or late cut. So more mature hays are going to could have lower NSCs as well.
So where does alfalfa fall in with those options?
Good question. So alfalfa is high in digestible energy, and that's mainly coming from higher levels of protein. Typically, they're around about they can range. They can range anywhere from 11 to on upwards to 18% NSC. So it just depends again on the lot and the cutting. If it's late cutting or early cutting. So late cuttings again will typically yield lower NSCs, but alfalfas are higher in protein, and protein can also be a driver of some of these responses. And so we still don't know a whole lot. If we feed a horse alfalfa, what's the response? If we feed a horse a Timothy or brome, an orchard, or Bermuda, what are the responses? Because they all have varying levels of starch, sugar, fructans, and all of that. So just a lot we don't know.
Dr. Adams, Phil in Alberta, Canada, wanted to know to what extent are these conditions caused by husbandry, and to what extent are they possibly genetic?
Yeah, good question. There's actually a couple of groups that are working on the genetic aspect of equine metabolic syndrome, and that'd be Dr. Molly McHugh and Dr. Sam Brooks. Molly's in Minnesota and Sam's in Florida. And so we do know that some breeds are more predisposed to developing an equine metabolic syndrome, and they're more your thrifty type breeds, so your Morgans, your Pasafinos, your warm bloods, Tennessee Walkers. So probably genetics are playing a role there. We don't know that yet. We have not yet identified specific genes that are predisposing these horses to become equine metabolic syndrome, but they are getting fairly close, I think, to identifying some of those. But we know that equine metabolic syndrome can affect all breeds. And with that being said, those that are not more predisposed or thrifty breeds, more than likely, then it's a problem to inappropriate management, overfeeding, and not enough exercise. So I think there's both involved, depending on what breed you're talking about.
Okay. And Dr. Dryden, Jackie in our live audience says she keeps hearing about Pergolide, but that her horse is being treated with Thyro-L. What's the difference?
So Thyro-L is basically a synthetic, it's levothyroxine, which is to help increase metabolism in the horse. And I use it a lot in these cases to help regulate their body condition score, to help them to lose weight and help maintain a normal metabolic activity. So it's a totally different component than the Pergolide. The Pergolide is actually being used to treat the pituitary pars intermedia, the adenoma in the brain that is causing the increased ACTH, so it's a completely different scenario, but can be very helpful. The Thyro-L can be very helpful in some of these horses that are overweight to get them to slim down.
Dr. Adams, we have a question from Roberta in our live audience, and at the horse we have our equine nutritionist who writes for us every Monday, Dr. Claire Tunes, and she's going to be super excited to hear that this question got asked. Roberta wants to know, how do I find a nutritionist who can help formulate a diet for my EMS horse?
Oh, that's great. I think that a number now of the nutritional feed companies out there are very willing to help. So Purina, Nutrina, Buckeye Nutrition, all three of those are great, wonderful resources with very knowledgeable people, very knowledgeable about metabolic problems. In fact, I think you could probably go, I think I was just on Purina's website, and they have a great fact sheet about equine metabolic syndrome and feeding these types of horses. So everyone's quite aware. I mean, Triple Crown, Southern States, Purina, all of these feed companies also have the low starch diet. So I think that they're very aware of the problem, and they're very proactive and would want to help you in developing the proper diet and management for these horses. So I think just reach out to them, call them.
And Dr. Dryden, do you work with any independent nutrition consultants or to help manage your cases?
Yeah, actually, there's several in Lexington that are very, very reachable. You can do a search in your area, and like Dr. Adams said, the big feed companies are very willing to help promote and get your horses lined out. They're very willing to do that for you.
I have a question, Dr. Adams, from Elena in our live audience. She wants to know, where can I get my hay tested for NSC levels? Some of the labs send complex reports that are hard to interpret. So do you have to be a scientist to understand these reports that are coming back from the labs?
Right, and I think the number one lab, or the gold standard lab, especially at least the ones that we trust and send our samples to, and a number of people do, is Dairy One or Equine, and they're out of New York, and they have a great website, and they have directions on how to collect your samples, and then all the different options for what you want to have looked at. And so, and I know they are also very willing to help understand the results from your reports. And also, I think working with your nutritionists are going to be able to help you also determine and decipher what all of those results mean.
We have a question from Valerie in our live audience. Dr. Dryden, I'll give this to you, and Dr. Adams might have some input as well. But Valerie wants to know if PPID, does PPID or Presend affect a horse's behavior? She said her mare became unrideable and dangerous this past fall and winter. What are your thoughts on that as a vet?
PPID can definitely have some characteristic changes in their mood swings. They can definitely be a little moody. The one thing that I have seen on some horses being treated with Presend is being a little bit lethargic. It's not all of them, but a few of them have been just a little bit sluggish after being treated for a while on the Presend. But Dr. Adams, do you have any thoughts?
No, I think just exactly what you said. We typically see, you might see early on a little bit of loss in appetite and lethargy, but that typically goes away, especially when the dose is adjusted. But in my experiences, we've never seen a horse react like that. But that might be a really good question for you to reach out to Barry or Engelheim and their technical support group, because I know they're also very willing to work with horse owners with horses with PPID and obviously treating them with their product. So,
is it possible for a horse that's been cushingoid, maybe under the radar for a while, you start treatment, and then that horse has all this energy because it feels better from treatment?
That could be.
That could be, yeah.
So, we have another question from Valerie in our live audience, and she would like to know if you have any suggestions for treats that you can give horses with EMS. She said she wants to treat her boy once in a while, but she also wants him to be healthy. Dr. Dryden, do you have any recommendations?
Moderation is key. An apple, slice of an apple, and a carrot here and there is not gonna put them over the edge. But they do make some zero sugar treats out there. But I don't think you have to be overly critical. As long as everything in moderation.
Yeah, and I think you could, offer maybe a small handful of your low starch or weight control commercial diets out there that are low in starch and sugar. So just, again, in moderation.
Dr. Dryden, Karen in Belgrade, Montana, had a question about mules. Are they affected differently by metabolic disorders?
Mules are similarly affected. I grew up with mules on our cattle ranch in Arizona, and dealt with metabolic issues. And I guess at the time, I didn't realize what we were dealing with. But looking back on it now, it was exactly what it was. Dealing with numerous cases of EMS and laminitis in mules, it is very similar to horses. So I have to say that these issues can be manifest exactly the same way in mules as they can in horses, and donkeys for that matter.
Yeah, definitely.
Dr. Adams, Corinne in our live audience wants to know what could be causing fluctuating insulin levels when you're consistently managing diet, exercise, and environment.
Yeah, good question. We are actually just wrapping up a seasonal study, because I told you early on that insulin, we think, is not affected by season alone. And that's been shown really in healthy horses. Not a lot of research has been done in the insulin dysregulated horse, so we jumped right into that, and we're just kind of wrapping that study up. And we are seeing some fluctuations of season having an impact on insulin dysregulation, and that kind of coincided with fluctuations in Presti-Nex scores and body condition scores. So an increase or slight change or increase in adiposity, which you may not be seen or is easy to see, could change adiponectin, leptin, and some of these values, and they all may feed back and have an impact, on insulin and insulin responses in these horses. We really don't have a handle on why we're seeing that these changes in season over time, because these animals are maintained on the same diet as well. Just sort of opened up a Pandora's box, probably.
Dr. Adams, we have a question from Emily in Ontario, Canada, and she wants to know if, similar to people with having metabolic disease, can a horse simply have an underactive thyroid?
Yeah, so it used to be thought that, PPID and even sometimes EMS were referred to as because of hypothyroidism, but research has shown that's not the case, that it's very rare for a horse to be hypothyroid, that their T3s and T4s are quite normal. And the reason that we use levothyroxine is essentially what Dr. Dryden said, is to essentially speed up metabolism. It's not really to replace or in any way, shape, or form have anything to do with hypothyroidism.
Dr. Dryden, we have a question from Lisa in California, and she says that she has a horse she believes is insulin resistant. He refuses to eat supplements. What else can I do for him?
Yeah, it's a great question, and being a practitioner, getting clients to get supplement horses, you have to get a little creative. One of the things that I like to do is sugar-free applesauce. Put the meds in that in a dose or syringe and give it to them that way, and at least they're not objecting because you're putting something terrible in their mouth. The other thing is you can use a small amount of ration balancer or your low starch feed. Mix in your supplements or your treatments, whatever you need, and then have a spray bottle of salt water, just tap water and salt, and spray that in there just to emulsify it, and so it sticks to the pellets and it has a nice salty taste. So that's one of the things a couple things that I've been able to do with my clients. It's helped.
Okay. And Dr. Adams, we have a question from Roger in Texas, and Roger wants to know if there's any way to get a horse to shed his heavy coat that's related to PPID.
The pergolide's going to help with that. So pergolide will actually help these horses shed out more appropriately. It may not be back to normal completely, but you will see changes once the horse is treated with pergolide and their ability to shed out better. I don't know, Dr. Dryden, do you have any? Other than that, I don't know of any other way at this point in time.
I just use a 10 blade.
So go ahead and body clip them.
Yeah, exactly.
Yep.
Exactly.
Yeah. So with these horses, if you're needing to body clip them, what do you do in the wintertime, or what recommendations do you make? Do people need to be blanketing a PPID horse in the winter, or do you let them get their regular coat in the winter? Is that coat appropriate for keeping them warm?
Yeah, I mean, it all depends on your management and what the horse is going to be doing. If you're up in Canada and they need all the coat they can get, you're not going to clip them till the spring comes in and the weather starts to warm up. So, I mean, it just really depends on your management and where the horse is and what they're exposed to.
Yeah, and if they're on the thinner side and are not insulin dysregulated, I think let their coat grow out, and also blanketing if needed.
Dr. Adams, we have a question from Kathy in Washington. Kathy has a 26-year-old Morgan who's been on pergolide since he was 17. What is the progression of PPID, and what can she expect as he continues to age?
Yeah, so that's a good question, and I'm glad. It sounds like she's been quite proactive in trying to catch this early on and not treating after the fact. So again, pergolide won't stop the disease completely, won't put the brakes on completely, but it's really going to slow the progression down of that tumor. And so you're then going to see slow progression. You're still going to see slow progression of clinical signs. So you are going to, you're not going to see those happen as quickly as if you weren't going to be treated, but you will see a very much of a slowdown in the development of clinical signs, such as, the hypertrichosis and the delay in shedding out, and polyuria and polydipsia and muscle loss, and all that'll happen very slowly with him now being on pergolide. And I think that's all I wanted to say there. Dr. Dryden, did you have anything maybe to add to that?
No, I think, if the horse is 26 and he's been treated since he was 17, that's a great job.
Yeah.
Great.
Yeah.
Good
That's
kudos
awesome.
to you.
Yep.
Terry in North Dakota wants to know about insulin resistance and laminitis. Should that horse continue to have exercise, or is stall rest better?
This is a great question. I'm really glad that it was asked, because in the acute stages of laminitis, the foot is very unstable, and I absolutely do not recommend exercising the horse when they're still painful, because those lamina are very, very, very they're fragile, and if you stress the horse by making them move in order to exercise them, you're only going to disrupt more lamina, and you'll have displacement, rotation, and possibly even sinking. So in those cases, I highly recommend that the horse be quiet and stabilized before we start to exercise them. So they're essentially, if they become laminitic, you've got to get them over the acute stage into the chronic stage where they're stable, and then start to exercise them as they can tolerate, because you don't want to overdo it.
We have a question, Dr. Adams, from Esther in our live audience. And Esther wants to know how pregnancy affects the hormones that are involved in these different syndromes.
Good question. I don't know if we necessarily have the data behind that, but great question, because pregnancy alone we know affects the rate of metabolism. And so pregnancy can actually sort of, in some horses, like some humans, you can develop gestational diabetes. And so that can happen in the horse as well. It can become slightly insulin resistant or insulin dysregulated with pregnancy alone. If the horse is already metabolic syndrome and or PPID, that's not going to be the greatest scenario, because then it's just going to worsen the underlying metabolic issues with that horse.
We have a question from our live audience. Dr. Dryden, I'll give this one to you. It's from Sylvia, who wants to know if there's a correlation, or have you seen a correlation with long-term PPID and calcium uptake and brittle bones in horses?
That's a great question. I don't know that I can definitively say I've seen a correlation. Typically, we see these in the aged horse, the geriatric horse, which does tend to have a more brittle bone than a young horse. So I think it would be hard for me to make that correlation. I'm just not aware of any studies that have done that. Dr. Adams, are you aware of any?
No, I'm not. No.
Dr. Adams, Shannon wants to know if EMS is a lifelong ailment, or is it something that you can treat and rather than just manage?
Oh, yeah, good question. So once an EMS horse is EMS, typically likely to sort of stay EMS, especially if they're of a breed that's more predisposed, while weight loss and all can happen in these horses by dietary restriction and exercise. If that horse is not tightly managed by diet and exercise, the weight is going to be very easy to come back, and the fat pad's very easy to come back on these horses. And in fact, the adipose depots are very difficult to get off of these horses. So yeah, I'd say that it's probably a lifelong battle, unfortunately. And then there's no research to show it, but we think that maybe the equine metabolic syndrome horse may tend to go on to become PPID later in life, but we're not 100% sure on this.
And then, Dr. Adams, we have a related question from Lori in Illinois. She wants to know if a horse is borderline insulin resistance, can the diagnosis be reversed by controlling diet and adding exercise?
Yeah, so if they're borderline, if it's caught early, which is the best case scenario, to improve insulin sensitivity, but very difficult if they really develop the severe crusty neck and all. So, again, if they're the thrifty type, it might be difficult no matter what you try and do to manage. But again, being proactive and jumping on these things earlier by diet and exercise are definitely going to be in your benefit, but I can't guarantee you that it will prevent them to become full-blown equine metabolic syndrome case, especially, again, if they're a breed that is more predisposed.
I think we have time for one more question. Dr. Dryden, Andrea is in our live audience, and she wants to know what role stress plays in elevated cortisol and ACTH levels.
Yeah, so that's another great question. And stress does have a role in elevated cortisol and ACTH levels, and oftentimes horses that are in a stress situation and are laminitic, and I'm seeing them as a patient for the first time, I actually wait a little while, about 4 to 5 days, and get everything calmed down before I pull blood to evaluate, because I can have a skewed idea of what's actually going on because of the stress level. So that's an important thing to consider when we're seeing a case for the first time, and kind of judgment on that case with it being in a stress situation.
Okay. Well, that is all the time that we have for tonight. We covered a lot of ground. I feel like we ran a marathon answering these questions. Dr. Dryden and Dr. Adams, thank you. We appreciate you guys being here and answering these questions. I want to go ahead and thank everyone who submitted questions ahead of time and everyone who joined us live. We had a big crowd tonight and tried to get to as many of your questions as possible. We also want to thank our sponsor, Metabolic, which is made by Equine. I hope you join us next month when we're going to be talking about colic and early intervention to save lives. Until then, from all of us here at The Horse, have a great night.